Those are two big ones. Another real big one is your bite force. Once you lose, if you lose all your teeth, your bite force, how you chew, there's an average of, they call it PSI, which is pounds per square inch. It's a unit of measurement. You have about 250 PSI, pounds per square inch, with natural teeth. Once you take your teeth out, you have 50 PSI. So you only have 25% the bite force, okay? And then over time, you can you lose even more. So I always tell people that, you know, that there's a lot of people can plumb your house. There's a lot of mechanics, and you want to get somebody. There's a lot of doctors, and you know, and the word board certified means that they've had extra training. Okay, so I've had a lot of extra training in dentistry and implant dentistry, and it's a big passion of mine because I just, you know, it's such a wonderful way to restore your mouth that I've really jumped into it full force. I've been doing it for 20 years now, and to become a board certified, I had to take some extra classes and some more hours of training, and I had to present some cases in Chicago to become board certified. So, you know, whatever you do in life, you really want to make sure that, you know, you interview your doctor, interview your doctor, interview your dentist, and ask them about the qualifications. What happens over time, once those teeth are out, you continually lose bone, and the bone loss doesn't stop unless you do something about it, which the treatment of choice for this is a dental implant. Once you place the dental implant into the jawbone, it stops this bone loss.
All right, and does it also stop the teeth from spreading apart, which is also part of what happens to the structure of the face?
Exactly, exactly. So if you have one tooth out, it can, the teeth beside it can fall into that area, and the tooth above it can grow down. So your teeth are dynamic; they constantly move. So that's another condition, and that continually happens. And a lot of people don't realize that you continually lose bone in that area, and it can cause that premature aging that we talked about. The reality is that 30 million Americans currently have some form of tooth loss. Okay, and it's a silent epidemic. And people really don't understand the consequences of tooth loss.
Okay, so does it promote premature aging?
Yes, it does. What can happen if you have all your teeth taken out, you can dramatically increase your aging very quickly. Because what happens once you take your tooth out, you continually lose bone in that area, whether it be one area of the mouth or the entire mouth. And you could lose that bone, and you do lose that bone constantly. And
well, how is that going to make you look older or to make you age faster? Is it going to be the kind of thing where you look all sunken in when you look in the mirror as well?
Yeah, you can get, we actually have a kind of a slideshow that I would like to show the aging process after you have your teeth out. And, you know, and it shows the chin getting closer to the nose. And
all right, is that a condition that has a name? Or
it's just it deals with bone loss. Okay.
All right, so we have this picture up here, and this is a great graphic. Let's have a look at this. We have no tooth loss on on one side of the face, and obviously she looks quite young. And then on the other side, it's, you know, there are more wrinkles, and it looks like she's even lost muscle tone and everything. You want to elaborate on this?
Yes. On the left side, you can tell the patient has all of their teeth, and on the right side, after all the teeth have been taken out, it'll show you what happens to the face. You have deep facial lines that get larger, and your lips will thin, and there's a condition called jowls where your cheeks will sag a little bit. Okay, and you can create a witch's chin, where the chin kind of sticks out.
Oh, it protrudes a little bit. So now, is this the kind of thing, so somebody goes and they have these conditions and they get a facelift, but it doesn't sound like they have the bone structure underneath to support that skin? Right,
exactly. So once the tooth is out, as I can show here on this model here, if you guys, if we can zoom in on this, there's a lot of studies out that show that you can lose almost 9.8 years. Actually, Harvard's done a study where you can lose 9.8 years off your life due to inability to chew properly.
And why is it so important to chew properly?
Because you can't masticate the proper healthy foods that we need. In fact, I had a patient actually from the show that he came to me. He actually had some polyps on his colon. And he came to me after watching the show, and he realized, and he came to me and he had no bottom teeth at all. And he had the surgery done in '09. So, so it took him this long. He said he had a set of dentures, but he just couldn't wear them.
All right.
So
for our non-doctors and non-medical professionals out there, when you say the word masticating, you're referring to chewing?
Chewing, yes.
Okay.
So he couldn't chew properly, okay? So what we did is I sedated him, and we placed some dental implants so he could snap his teeth in. And he's in the process right now of getting some new teeth that he can chew with.
So, and when you put the dental implants in, is this something where you put them in, the permanent ones are in the first time that you put them in?
You can, there's a series of steps that you do with the dental implant. You place it in the jawbone first, and you can sedate the patient. I like to sedate my patients because, let's face it, who really likes to go to the dentist? And there's a lot of fear involved with you know, because the fact that the patient comes in and they have tooth loss, okay? You realize that they usually have high fear. There's an incidence in their life where they you know, they got traumatized by the situation. And actually, I had a patient today who had some major trauma and their teeth were bad. And once you get traumatized by the dentist, you don't really want to go. You know, so it's up to me. It's up to our staff to assess that. And to focus on that first before we even treat the patient at all.
Just to get them comfortable
Just
and
to
to
get them
come
comfortable and to be able to come in and you know, and go through this procedure again.
Do you know how many people, statistics, are affected by tooth loss?
Yeah, there's about 30 million people currently, and it's a silent epidemic, and people continually will lose more and more teeth. The statistics say tooth loss is related to age. And the older our population is getting older, so.
Why do you think that the bone loss, other than the visual aspects, would cause premature aging? Would that also be on your insides as well? Or is that just a visual thing?
It's more of a visual because, you know, the teeth support the face. They support the bottom third of the face. And so once you lose your teeth, your jaw gets closer together, and we have a graphic that I'd like to show now. It's actually a little simulation of what happens to the jawbone after you have tooth loss.
All right, so we'll go ahead and bring that up. Here we go. This is progression of aging following tooth loss.
Yeah. So as soon as you lose those teeth, you can lose a tremendous amount of bone quickly. As we're showing here. See how the chin gets closer to the nose, and people don't realize that.
Now, is this something that you can actually reverse, or is this something that once
you can prevent this? Because what happens is right after you take your teeth out, from day 1 to day 365, the first year, you lose 30 to 40% of the bone support that supported your teeth. There's two different types of bone. There's alveolar bone that holds the tooth in, and then there's another type of bone. And as soon as you take the teeth out, the bone goes away. So dental implants can prevent that.